Welcome back. We're joined now by Dr. William Snyder, who is a physician at Pureview Health Center. Thanks for being on our show.
Well, thanks for having me.
How many people does Pureview serve?
Well, Pureview Health Center serves over 7,000 people in Helena and Lincoln and parts of Broadwater and Jefferson counties.
What does Pureview mean to the folks that live in Lincoln?
Well, Parker Medical Center in Lincoln serves the community, the surrounding community, and it's open 8 to 5, Monday through Friday. It has a provider, nurse practitioner, Laura Broussard, and really, I think, allows the community to be successful. I mean, if you're a community like Lincoln and you don't have a clinic, then folks who have chronic medical problems, seniors, or families really have to drive over 60 miles to seek care. And it would be really hard to live in a community if you had to do that.
I understand Pureview is a patient-centered medical home. Can you tell us, what does that mean?
Well, patient-centered medical home is really team-based care. So it's nurses, providers, care managers, case managers, dentists, mental health professionals, diabetes educators, pharmacists, really all working together for the patient. So a patient-centered medical home really allows us to move away from episodic care and more into proactive care. So episodic care would be sitting at home and thinking, I need to see the doctor. And you call up, make an appointment, come in, see the doctor. But really, besides that interaction, you really don't have much contact with your medical team throughout the rest of the year. You might go in once, twice, 3 times a year. But with a patient-centered medical home, particularly with folks with chronic medical conditions, we're going to be having proactive care. So we may have care managers reaching out to you to see if you have any questions, to make sure that you're up to date on your lab work and that you're getting the care that you need to get at the right time. So that's really what a patient-centered medical home is all about, is putting the patient at the center of the care and not the provider or some other resource. Patient-centered medical homes really improve efficiency, they improve patient outcomes, they improve patient satisfaction, I believe, and certainly save money, or more cost effective for everyone, for the patients, for all of us. The patient-centered medical home really is about the communication between all aspects that I mentioned and care coordination. And to be a patient-centered medical home, recognized, you have to meet certain standards, and I believe all the community health centers in Montana have met those standards. And for Pureview, we've met over 125 of those national standards that clinics like ours would need to meet to be an officially recognized patient-centered medical home.
Impressive. Many patients talk about how confusing it is when they go to the doctor, go to their practitioner, and they're given lots of verbal information, and then they're also handed a bunch of material. And it is confusing. So how does a clinic, healthcare system like Pureview prevent that scenario from happening?
Well, that's really all about being a patient-centered medical home and getting away from episodic care. So our team, our diabetes educator, our pharmacists can help answer questions, reach out to patients should they have questions, make sure that they're understanding what their medications are, why they're taking them, understand their chronic medical problems such as diabetes, and really try to go the extra mile to reach out, be proactive with patients for that education.
So you've talked about the patient-centered medical home and being patient-centric. Can you talk about a couple of success stories you might have seen as a result of this model?
Well, I see patients have success really every day with identifying and making lifestyle change or lifestyle modifications. It may be stopping smoking or cutting back on cigarettes or changing diet, losing weight, even just taking medications, committing to come to the clinic and come to the provider, talking to the resources. I think when you make these lifestyle changes, when you make the commitment, then patients come back, they see the success they've had on their own, using the resources from the patient-centered medical home to make these changes, coming back, they've lost weight, their blood pressure is better, sort of see the benefits of it. And I think the success really comes from the patients working with the clinic and with the medical home.
What is PureView's relationship with Lewis and Clark County?
Well, PureView is a department within the county, and we utilize the resources of the county to be successful for ourselves and for our patients. Although the PureView itself is a 501c3 not-for-profit clinic, we get a federal grant to see patients, but we are part of the county family.
So do you have a community-based board that oversees PureView?
Yes, our board is made up of 51% users or patients of the clinic, so that they really have a stake in the care that's provided and the success of the clinic, and they understand what happens at the clinic. The board helps set policy for the clinic. It helps establish the strategic direction and approves the budget.
How often does the board actually meet then?
They meet monthly.
And if, as a community member, I were interested in being on the board, in the time that we have left, what would I do?
Well, if you wanted to serve on the board, you could go to pureviewhealthcenter.org and see the information that's available there. You could contact our executive director, Jill Steele, and express your interest. I think she's always looking for people who would be dedicated and good board members.
Excellent information, Doctor. Thank you, Dr. Snyder, and I would like to thank Cindy Sturgar as well. I hope you at home enjoyed our show today, and we'll see you next week. In the meantime, stay fit, stay well, and stay healthy for life with Healthy Living for Life.
Healthy Living for Life is brought to you by Mountain Pacific Quality Health. We'd love to hear from you. If you have suggestions for future programs, visit our website at mpqhf.org or call us at 406-443-4020. You can also catch us on YouTube by visiting our website and clicking on the YouTube icon. Special thanks to Fire Tower Coffee House and Roasters. Production facilities provided by Video Express Productions.